Hello and welcome to Always in Escrow, a show that inspires. I am joined today by my co-host Colby Burchin and a truly inspiring guest, Dr. Jaclyn Klimczak, a leader in the world of facial plastic surgery, whose work isn't just about aesthetics, but about restoring confidence, transforming lives, and redefining what it means to feel good in your own skin. Whether you're curious about the world of facial plastic surgery or simply love a story about following your passion and making an impact, this conversation is for you. Dr. K, welcome to the show.
Thank you so much for having me. I appreciate it.
Serena, this is a very special treat for me because my whole family loves Dr. K, but my son especially, he had his ears done, pushed back, and Dr. K did the surgery and made his confidence level to another level because now he is an identical twin, but he looks identically to his brother's ears. So, Dr. K, thank you so much for joining us today.
Oh, thank you so much for having me. I appreciate it.
Okay, so what first drew you to the world of facial plastic surgery?
So, great question. I always loved medicine growing up, so I kind of kept going back to wanting to be a doctor. I come from a family that actually has really no medical personnel in it. My father is a lawyer. My mom ended up being a mom, stay-at-home mom and taking care of my brother who has Down syndrome when we were younger. But I was always drawn to medicine, and then as I kind of went through the fields, facial plastic surgery is very artistic. So medicine can be very left brain, very cerebral. I enjoy the, challenges that come with that. But that artistic nature of facial plastic surgery kind of blends the two. So you get to, dive into a more creative side. I also love it because I think it just brings confidence to a lot of people. So as a surgeon, you have a very much a fix it mentality. If you have a problem, you want to allow patients to get better and feel good about themselves. So it's a very rewarding field. I tend to just navigate toward the face when I went through my training. I love the fact that it is one's identity. It means a lot to each and every person. It doesn't give you just your senses, but it's the way that you interact with other people. And I think that's just such a beautiful thing. So restoring people's confidence, whether it's with a cosmetic work or with reconstruction, has always been extremely rewarding.
Incredible. And for those who may not be familiar, can you walk us through the types of procedures facial plastic surgeons typically perform and how they impact people's lives?
Absolutely. It's a very broad field. So I know with the media today, plastic surgery has its own stigma, but facial plastic surgery has a very wide range of things that you can do with it. Obviously, we do the cosmetic side of things with facelifts, eyelid surgery, brow lift surgeries. We do nasal reconstruction and rhinoplasty. It comes with doing both surgical and non-surgical. So we do fun things like Botox, injectables, lasers. Skin comes into it a lot of time. But one of the other sides of it is also reconstruction. So we do a lot of reconstructive surgeries. A lot of skin cancer patients come to us post their excisions, and we'll put things back together again, in ways where we try to really hide those scars. Patients with severe trauma or with nasal obstruction will come to us so we can get them not just looking good, but also breathing well and feeling good about themselves. So anything that has to do with the eyes, the lips, the nose, it comes from not only looking at it in a cosmetic and aesthetic way, but also function is really important. Because while, it's nice to have a pretty nose, you want to be able to breathe through it. So all those things are really encompassed in facial plastic surgery. It's a very comprehensive approach to all this.
Unbelievable. Really incredible what you do.
Becoming a facial plastic surgeon is no small feat. What can you share a bit about your training and the journey it takes to get here and what kept you motivated along the way?
I think you have to look at the end goal to kind of keep your motivations in check. If you think of it as, oh, this is going to be like a 15 to 20-year endeavor, it can sound very daunting, but honestly, I really did actually like the training as I got through it. So it's 4 years of medical school. I did my medical training actually here in Boca Raton, Florida at FAU. And then it's a 5-year surgical residency program. So there's a couple different avenues you can go with facial plastic surgery. I was trained in ENT or otolaryngology, which again just focuses on the head and neck. So we do things inside and out when it comes to, your face. When you go through an ENT training program, I did mine up in New York City at Mount Sinai. And after going through that, you have a very thorough approach to the anatomy, the physiology of the head and neck region. So approaching a facial plastics, again, whether cosmetic or reconstructive, after going through a training like that, is incredibly thorough. I was lucky enough during my training where they threw in a pandemic halfway through, so we got that added bonus, I think, through everything. But after you do your training, you go to a fellowship. So I did my surgical fellowship in Birmingham, Alabama, with two facial plastic surgeons. One's name's Daniel Russo, who was a president of the American Academy of Facial Plastic Surgery, as well as the Hair Restoration Society, and Dr. Austin Adams. So I spent a year there. At that point, you're kind of working almost as an associate. So I did a lot of cosmetic and reconstructive procedures under the guidance of those two physicians before then going out on my own and joining a practice. So it's a long road, but training, once you get to residency, once you get to your fellowship, once you get through all the book work, it ends up being such an incredible experience. I am so thankful for my residency and my fellowship because when I really got out into the world, I felt like I was pretty confident at tackling anything, which was nice.
Wow. That's incredible, that journey. Oh my gosh. How does facial plastic surgery differ from general plastic surgery, both in practice and in philosophy?
Great question. So, facial plastic surgery, as it says in the name, just focuses on your face. So, we've kind of honed into the anatomy, the physiology, everything that has to go into the head and neck region. So, we don't do anything, what I say to my patients, I don't do anything below the clavicle. Um, General plastic surgery can do breast surgery, they can do body surgery. Sometimes they'll go into burns or amputations with their reconstructive process, but they also can do facial plastic surgery as well, but they tend to do kind of a whole body. I really wanted to be, and this is just my mindset when I got into training, I really wanted to be not just good at everything, but excellent at something very specific. So when I went into facial plastic surgery, I really wanted to be able to kind of balance and look at someone's face and again restore their confidence or, something that was taken away from them and get really, really proficient at that.
Wow.
Philosophy wise, they're pretty similar. I mean, it depends on the approach. So, a lot of doctors can go into different avenues with it. Some are more cosmetic, some are more reconstructive, some will do a combination of both. But ultimately, I mean, hopefully, they all share a very similar to philosophy to myself, which is again restoring a patient's sense of confidence, sense of function, and sense of just, you know, um, ability to go out there with their, identity being their face and feeling good about themselves.
That's so beautiful. Do you have a favorite procedure or type of case to work on? What makes it especially meaningful for you?
That's probably one of the hardest questions that I get asked, and patients will ask me this all the time. So I think if I ended up doing just one procedure over and over again, one, it wouldn't give me joy because it doesn't balance again the face when you look at it. So I think I do enjoy really every single procedure and the variety. And I think it's because when someone comes in, it's not a copy paste or a one size fits all type of surgery. You really have to look at somebody and balance their face and put things back together again, or look at what they're trying to achieve and give them the best possible results. So the fact that it's so thoughtful, that process really makes me enjoy all of the procedures. I think when they come in, I never wanted to be somebody that says, well, I can kind of do your face, but I don't feel confident doing the eyes or the nose. I like being able to say, okay, we can address all of this to get you whatever result that you're looking to get at. Skin cancer reconstruction, or we call it Mohs surgery, has always been a special place in my heart. I did a lot of that in my training. And I think that surgery, because people don't really ask for it. It just happens. You go into your dermatologist, you see a little tiny bump you thought, and then sometimes you come out with a hole that's larger than you think in your face, which is really a personal experience to go through. And I always tell patients, whether it's one surgery that they've had done or 10 of these, it's always as emotional. So I've always really loved keeping that a part of my practice because I think it's so effective, especially in South Florida. Can't get away from the sun here, but giving patients back that confidence and being able to take them from something that's pretty heartbreaking to getting them to that finish line is really rewarding.
I feel like Dr. Serena, actually, Dr. Naklis, Dr. K works with Dr. Naklis, same office. I feel like Dr. Naklis's fame around our area is his nose. They call it the Naklis nose. People go, there's a Naklis nose.
I don't have as much of an alliteration with my last name. I don't think anything rhymes with Klimczak very well, unfortunately.
So, in a world where people can sometimes take cosmetic procedures too far, do you ever find yourself turning clients away?
I do. I'm very honest with patients. And the reason is because your relationship with your physician is a very personal one. So if I don't think that I can 100% get someone to where they want to be, or if I think that they're going to start looking outside of their natural beauty for something that just isn't either attainable or looks frankly strange, I really just don't think that I would be the right person for them. So that's a really honest relationship. It's not about just, everyone needs something and can do something. It's about getting someone to be happy in the end. And that is a really important concept that I really try to dial into my patients is, and they come into me for even their consults. I want to see what their goal is and what they're trying to achieve. Sometimes we'll take pictures of them before and I'll image them after to show them what I can do to get them that result. And if it ends up being something that's outside of that realm or looking a little bit strange or like a caricature of themselves, and I don't feel comfortable doing it, I let them know that, there might be somebody else out there that might be able to get them there. But I think you really do have to have an honest relationship with patients because it is in some ways a lifelong relationship. And I want everyone to be happy in the end. That's the biggest goal of mine. If they're happy, then I'm happy.
That's a great way to look at it. I'm curious, have you ever worked with a patient whose transformation went beyond the physical, someone whose procedure truly changed the course of their life?
Yeah, absolutely. I can say that probably on a couple different levels. We've had patients that, again, a lot of the skin cancer reconstruction patients can kind of fall into this realm where, they come in and they're extremely upset about maybe their entire nose being taken off by a skin cancer and very hesitant for surgery and now almost feeling a little distrustful because they thought they had one little spot and now half of their face is taken off. So gaining their trust, kind of going through the process and being honest that it's not, I 100% of the time people have heard me say, I wish I had a magic wand and could just like in 1 second make you heal up. But explain to them that this is a process, the healing is a process, and that, I have them come back and have those follow-ups to kind of show them that, you're doing well or something isn't going well. We need to change the course and action. So they're at least understanding about their post-op recovery, what they're to expect. But I have had patients that come in and they feel like their life is really transformed afterwards. They have a lot more confidence. One girl I can say in general was a young female. She was probably in high school at the time, adopted by a single father, and she had gone through a lot of adversity. I think she looked different. She had a larger nose. She couldn't breathe through it, and she was really bullied in school. So when I first met her, she was very removed. Didn't want to talk. Her dad kind of spoke and said, this is what's bothering her, but was very shy about it. And this little girl, after going through, we did a rhinoplasty on her and then, some nasal surgery to get her breathing better. Her confidence level when she came in her office, like we took her from going from someone who was really shy to like someone who could run for president now. And that was so rewarding to me is just see someone that's kind of clammed up and feeling bad about themselves to walk in and feel great because she should have felt that, I know, from day one, but just this little thing that I did made her so much more confident. is every reason worth what I do every day.
So rewarding.
Certainly. Oh, that's awesome.
That's
Oh, life changing, really. I mean,
Yeah,
and that you're able to see it through and have those visits and that personal time. Wow, what a shift. That's incredible.
thank you.
So, facial plastic surgery is constantly evolving field. How do you stay current, inspired, and innovative in your work while maintaining your personal sense of artistry and integrity?
I think the most important thing is staying active, especially with our academy for the Academy of Facial Plastic Surgery and with other doctors. So I always knew when I was going into a practice, I liked working with other physicians instead of being completely solo. And one of the reasons is because it is always evolving this field. So having those connections with other people in the community to see what they're doing and staying humble about it. I mean, there are some phenomenal surgeons that are out in the country. So I went to a course, I think about a year ago down in Fort Lauderdale with a bunch of facial plastic surgeons who brought all of their techniques in that we get to learn and kind of see their results, going to national meetings, being speaker at the meetings, but also being an attendee in the audience and listening is really important. I think it's easy to get stuck and think that I do everything the right way, but you'll be humbled by patients and wound healing and their own journeys. And so to stay open just keeps you humble, I would say, at the end of the day. And it allows you to kind of grow as a physician and surgeon, so you don't stay closed-minded to a lot of the innovations that will come out, the good and the bad. And so I think it's really important to keep that education and that knowledge up and, those close relationships with a lot of your peers.
Well, we can't thank you enough for coming on the show. How could people book their consultation, book a surgery, get their confidence up? How could they find you?
So I am in Boca Raton, Florida. My website is my name, so it's Dr. JaclynKlimczak.com. You can search me on Google. Our numbers are all on there, and I'd be happy to take care of you.
You're amazing. I can't thank you enough. My family loves you. We're obsessed with you.
I love your family too. And again, like making him feel good about himself was everything to me.